We're going to continue our discussion on ADHD, but in particular ADHD in adults. We've talked about how it is with children and adolescents, the risk of non treatment, and some of the biases against it. But how does it manifest in everyday life for adults who have non diagnosed ADD?
It's very interesting because I tend to wake up every morning and do some reading about the news, what's going on in the world. And recently, there's been a lot of publishing actually about adult ADHD, and a lot of it is coming from Europe, the UK, Australia. But it sounds like there's a new interest, if you may, on the whole issue of adult ADHD. And we make this artificial separation between kids ADHD and adults ADHD mostly because there are some differences, right?
Mhm.
And there are different interventions in terms of how to treat this. The reality is that if you're born with ADHD, you're going to have it for the rest of your life, right? And it's going to have an impact on learning, is going to have an impact in socialization, is going to have an impact on taking or not taking risks as an adolescent, depending on you being treated or not being treated. And those two things need to be are going to have different prognosis. But when you get to be an adult, and let's define what that means. You see, when we talk about being an adult in the biological, psychological sense, we're not talking about being 18 years old.
Mm.
We're talking about being 25 years old.
Well, the prefrontal cortex is done, correct?
Exactly. So when the prefrontal cortex has developed to the point that we can say there's some stability in that prefrontal cortex, then we can say that you have matured biologically speaking and psychologically speaking. So some expectations are needed at that point.
So
But when
for our listeners, while we talk about, if you don't mind, telling them why the prefrontal cortex is so important, what does it do, and why does that define them as a functioning adult at that point?
the whole area of the prefrontal cortex, including the dorsolateral prefrontal cortex, which is very important for us in psychiatry, and the frontal lobes in general, are in charge of executive functioning. What does that mean? It means our ability to process information and come back with an answer that is appropriate to the input we're getting, right? Understanding that we are at very early stages of knowing the brain, right? I mean, I was reading an article the other day, and the author of the article was saying the brain is the most complex and fascinating uh, element in the universe.
Hmm.
Okay,
Every
so
computer in the world put together couldn't do what one brain does.
no, and it probably is the second most fascinating thing in the terms of science and functioning after the universe, right? So the universe is kind of complex and infinite, right? But the brain is kind of close to that. It's very difficult to come to understand how an organ in the side of your head manages everything that happens in your body. I mean, if we're not talking only about thinking and problem solving, we're talking about you standing up
Mm.
and your brain knowing where your leg is, where your arms are. How come you're not going falling forward or falling backwards? Somebody gets too close to you, the brain feels it. So there's so much stuff in the function of the brain that when we talk about attention and concentration, we're kind of using a misnomer because attention deficit hyperactivity disorder reflects the three most common symptoms of this disorder, which is lack of attention, lack of impulse control, and hyperactivity, right? Those are the traditional symptoms. But the way processing in the brain is a lot more complex and it has an evolutionary component. What does that mean? It means that as we get older, okay, we learn in the context of being inattentive
Mm.
because the function of the brain is to help you adapt, right? So you have to adapt at different stages of your growth, the different needs of the brain. before maturity, right, before age 25, the brain needs input to develop new connections, right? So, as the brain is growing and cleaning up and becoming specialized, we're going to have different needs for that person as an adult. So, input comes in, output is their executive functioning and decision making process. And if you think about these particular symptoms, attention, lack of impulse control, and hyperactivity, there is one symptom that seems to reduce over time, and is the hyperactivity, but not the impulsivity or the inattention.
Mhm.
So those two symptoms pretty much remain in adulthood, right? So we need attention for a lot of tasks. We need problem solving for a lot of tasks. So once you become an adult, your brain is specialized actually to the career you're going to follow, right? So
Hmm.
the decision of treating someone as an adult is going to depend on um, what are the needs of that brain and that individual, not only in terms of work, but in terms of relationships, communication with family, children, and so on. So if you think about somebody who graduated from college, right, and decided to become a park ranger and has attention deficit disorder, it's going to be very different than somebody who goes to a technical school and learns to fix watches, right? The degree of attention and the environment where you're going to be at is going to be extremely different. So, in that particular situation, the decision of using treatment or not is going to depend on how much the individual is being affected, right, by this whole process of lack of attention and impulse control.
So at 25, as you said, that executive function area of the brain is that it's complete. It should be working properly. And I think in the last show when we were discussing it, you said a lot of the input from the environment comes in, it's short term memory, and then the decision making to respond to that does come from the long term. And sometimes that's a kind of it's been misfiring, and that's why that executive function doesn't work. Is that correct?
Well, kind of. You see, in order for you to make a decision, okay, before you embark in the microseconds of decision making, you have to have inputted the right information. Right? So if you're going to have an individual having to make a decision of buying or not buying something, right? You have to make that decision based on the input that is coming from the information, whether it's coming from the computer, from the person you're having a conversation with. If you are missing some factors of that input, okay, because you're not being attentive to it, your decision making may end up being faulty because you're not being able to measure all the risks and consequences because you didn't get all the information. And there are ways of retraining the brain. I mean, there are psychological and neuropsychological ways to retrain the brain. So every function of the brain becomes terribly important in trying to help an individual have proper decision making. Let me use an example, and I use this frequently. And it has to do with decision making in a relationship, not at work, right? In which um, you have an individual who is either a man or a woman who have attention deficit disorder, who tend to hyper focus so they can pay attention to what's in front of them. And in order for them to do so, they have to sacrifice other senses, including hearing, including smell, including touch, all of that, right? So any intrusion into those areas of sensory is going to be a surprise to the individual with attention deficit disorder, right? So let's say that it's a woman is having dinner with her husband or her boyfriend, and she decides that after dinner or lunch, she goes to watch the news, right? Or watch a show, whatever. And it's kind of embedded into that, or decides to play a video game and is totally embedded into that. And then her partner comes in after that and wants to cuddle with her, right? When the person tries to cuddle and gets close, or says something, is distracting her from the situation, right? And she may react impulsively, meaning may push him away
Mm.
or push her away, right? At that moment, that creates tension, right? Because the perception of the person without attention deficit disorder is
It's rejection.
I'm being rejected, right? And that may start a fight or a conflict in this relationship that is kind of precipitated by invading the space of somebody with attention deficit disorder.
Mhm.
That happens every day, right? So what happens is when you have somebody who's an adult with attention deficit disorder in a relationship, it's important to help them understand that and to create some rules because the attention deficit disorder is not going to go away. Now, if it's severe enough that this is constantly happening, right? And this girl gets accused of not paying attention, well, she's not being accused of anything that is not true. It's
Mhm.
not that she's not paying attention, she cannot pay attention.
Not capable of it.
Exactly. So we get into the the dichotomy of are you unable or you unwilling, right?
Mhm.
Now it's a lot easier to say you're not willing to pay attention. We very seldom say you're not able to pay attention. And that becomes terribly important because we as an individual and the people around us have to have a conversation about it, not present it as a criticism, not presented as a self-esteem issue. You're not worth enough because you don't pay attention, right? It needs to be presented as I have noticed that you're not paying attention, right? And I think that there may be more than just lack of will, right? And by the way, our 7 year old kid was just diagnosed with attention deficit hyperactivity disorder. What we find fascinating in psychiatry is that we usually diagnose the parents after we diagnose the kids.
And you said that's quite often, actually.
More often than people will think, because you see, our society, our Western society, and society in general is very much based on success, right? It is very much based on fitting. I want to be part of. So people with attention deficit disorder will make an effort to do so. They will make an effort to fit. They will make an effort to succeed. But very often they're not able to. And those are the people that we need to identify because those are the ones that may require more treatment. I mean, statistically, and I haven't looked at the numbers most recently, but statistically, I would say that 4 out of 10 individuals who had attention deficit disorder as children will require medication or treatment as adults.
Wow, that's a big number.
Yes, it
And
is.
so you mentioned how it can, depending obviously on the environment and the job, how that's treated, but and relationships would be the most difficult. But just let's pick an everyday job. I'm working in an office. I a medical office, right? I'm working in a medical office. How would ADHD manifest, and how would you treat somebody with that, and why would they need it? Or is it so distinctly unique to each individual that it's really hard to just say, hey, I would treat it this way.
Let me give you an example. I saw a girl the other day, well, a woman. She's in her early 40s, and she works in a dentist office, right? And she came to our offices with a complaint of being depressed and being very anxious, right? So we found that she had been treated for depression and anxiety in the past with very little efficacy, if you may. So in my business, a lack of response to a treatment is a red flag, right?
Mhm.
Because we have to pull back and say, well, are we dealing with something else? And about 3 months ago, when I saw her for the first time, she had been seen with some of my associates. I noticed that she was very impulsive. She was responding very quickly and answering my questions without really giving it much thought, right? So I noticed the impulsivity. So I started questioning her, are you having difficulty staying focused at work? Are you making mistakes at work? Are you daydreaming a lot at work? Do you find yourself procrastinating, and doing things until the last minute? So those are some of the symptoms you start noticing, right? And I started asking her, do you get easily irritated with your husband, right? In terms of the relationship, uh, do you feel overwhelmed by your husband and your children in terms of all the demands that they have of you, right? Is that causing you other problems like difficulty sleeping at night, worrying too much, and so on? So we did some testing with her. There's some objective testing where you can actually measure attention and impulse control. There's a test that we use frequently called the QB test, which we find very useful, and it gives you some guidance. It's like doing an ultrasound with somebody with suspected appendicitis, right?
Mhm.
You have the diagnosis clinically, but you want some confirmation to make it more solid. We noticed that she did have a lot of inattention, not a lot of impulsivity, right? So we started treating her with Adderall. And I just saw her about a week ago, and her life has changed, right?
Mhm.
Why is that? Because it's like you take the blinders off a horse. All of a sudden, you can see the world wide instead of in front of you. Because what people with attention deficit disorder learns to do is it only matters what's in front of me. Whatever is down here, I can't pay any attention to anyway. So they go from one box to the other box to the other box, right? But sometimes they can't return to the other box, so that gets very overwhelming. And
Mhm.
and and contrary to popular belief, people with attention deficit disorder tend to be very intelligent,
Yeah, very much so.
but they have difficulty with those details. And because it's been an illness that we pay a lot of attention in children, right? We usually think about learning, okay? Adaptation as teenagers and so on. But when we get to the adults, we forget that the world of the adult is complex and mostly complex between home, relationships, and work, right? Those are the two major environments. And it's very difficult for them to do any forward planning. So when you live with somebody that has attention deficit disorder, you feel like you're living in the here and now all the time. You know, it's like you try to do some planning if you don't have attention deficit disorder, and the plan gets nailed down to what we're doing today, right? So it's kind of difficult for them to look forward, and that causes them a lot of anxiety, right? Because they go from day to day to day, whatever's in front of them.
It sounds like the anxiety that comes from that or the stress manifests itself, like you said, with this lady in depression. So misdiagnosis must be rampant for these people.
It's very common and I tell my students this all the time. Whenever you have an individual, especially in the early 20s, mostly females that go to college and they start failing and they come back depressed and demoralized, they had to be ruled out for attention deficit disorder because these kids are not necessarily coming back depressed, they come back demoralized.
Hmm.
Okay, and we start treating the depression, doesn't get better. We send them to therapy, nothing changes. So um, think about sending a patient with attention deficit disorder to group therapy, right? How effective would that be?
Probably not very.
Exactly. So, or even sending them to therapy?
Yeah.
Will the person have enough attention to interject some of the data that is being provided to them about how to change their behavior?
Hmm.
So when we talk about non-medication treatments for attention deficit disorder, I usually talk about not dealing with the past at all. It's just how do you go about learning new techniques so you can expand your concentration a little better? And it's not very complicated because the therapy for attention deficit disorder is not about talking. And by the way, they're very good talkers, right? But they jump from one topic to the next and they don't stay concentrated on what you're talking about, and you reply, just giving some advice, and they weren't paying attention to you anyway. So it's all practical stuff, exercising, things of that
Is that
sort.
like cognitive behavioral therapy and things of that
Yes.
nature? Okay,
Well,
so
cognitive behavioral therapy and neuropsychological training, you can actually retrain your brain to concentrate better.
interesting. So what if what would it look like for someone to be so severe that you would use medications as an adult?
Well, they're usually, and we've talked about this before. For me, more than the symptoms is the function, right? So I always ask the patients, what is this doing to your life? So if the patient says, I'm not able to work, I'm going to lose my job, right? I'm not able to succeed. I know what I have to do, but I can't do it. You know, my wife is kind of sick and tired of me, or my husband is sick and tired of me. I need to get better organized with my life personally. That is somebody that you have to say, this person needs an intervention, they needs treatment, at least to correct the things that we can correct. And once we have help reduce the intensity of the inattention and impulsivity, then we can move to the rehabilitation part, right? It's very difficult to do much therapy if we don't have really the uh, the attention and concentration and executive function at least improved.
And the options and the medications are very much similar for the with adolescents, the Adderall groups and the like, or is it different for adults?
No, the medications are the same. We tend to use probably the stimulants more with adults. Let me take that back. We don't use the non-stimulants as much with adults as we do with children, like Strattera, Guanfacine. But we tend to use the stimulants a lot. The stimulants are the most effective, uh, quick-acting medications to help somebody concentrate better. Now, go ahead.
I was just cu- curious. What are some of the professional areas in which you see people with ADHD excelling without treatment?
Uh, you see, people with attention deficit disorder tend to hyper focus a lot. So when they have to do work in a cubicle with a computer without a lot of noise and distraction, so anything that has to do with drafting, financial stuff, you actually can do very well as long as you are just doing one thing in front of the computer. It doesn't mean that they can multitask. I mean, kids and adults with attention deficit disorder are great at video games. They're
Hmm,
really very good
interesting.
at them because they're very good at hyper focusing. So anything that requires hyper focusing, as long as you're in the right environment, you might be able to excel at.
Interesting. And
But
what are the
but
areas where
but
they
that's
tend to
but
fall completely
yeah,
apart?
well, but that's not going to mean that it will be the
The rest of their
same
lives are functional.
in their relationship, right? So
Okay.
again, overall, we're looking at a balance of functionality where both the individual can be adaptive and be able to find and provide contentment in their environment, right?
Hmm. So you mentioned some testing. So if someone's listening to our show and thinking, "Wow, that sounds like me," where can someone, other than going to a professional, get some input to say, "Okay, am I just a little bit inattentive, or do I actually may have this disorder?"
Well, you need to be assessed, and I actually tell people to start with your family doctor. If you're an adult, start with your internist and mention, I think I may have had some symptoms. They may make a referral to a psychologist or a psychiatrist to do an assessment. Neuropsychologists are actually pretty good if you want to have a comprehensive assessment of all the executive functioning. And I always advise that we do that. Some physician offices like ours will have the QB test available. It's a computerized test. It's not something you have to do paper and pencil, but you basically have to play with the computer in terms of problem solving. And the computer has cameras and it's actually measuring your attention, distractibility, all kinds of different things. It's really fascinating.
Hmm.
I mean, it's not infallible, but it's probably some of the best things we have to measure at this point. So I guess you can go online and look for a QB test, and you might be able to find some places that provide that service. We use it a lot with kids too, because parents usually want to have some objectivity and not just jump into this, especially because some parents are somewhat reluctant of using a stimulants, which actually the best and longest known treatment for these disorders. It's
Mm.
becoming more acceptable in adults to use them. You see, stimulants have a bad reputation, especially in colleges,
Oh yeah.
because a lot of people will sell the drugs and get high with them and take excessive doses. The reality is that, uh, and we learned this the hard way over the years, it is that studying with stimulants by staying awake all night defeats the purpose. It doesn't help you learn anything better. Actually makes it worse. But everybody wanted to try that. So
Interesting. So, someone who thinks they have ADHD obviously get assessed and looked at. You mentioned before it's quite common that a child who has ADHD has at least one parent. I think you said 70% have one parent with ADHD. What is that relationship like? An adult with ADD and a child with ADD?
pretty chaotic. And it's actually pretty chaotic and painful for the parent who does not have ADHD.
Hmm.
Okay, because that is the parent that has to problem solve, uh, not impulsively, right? So it's not, you see, it's not that the people that adults with ADHD don't problem solve. It's just that they just problem solve here and now. Their problem solving is not directed toward a connection with the process that is going to prevent that from happening again. So it gets very repetitive, right? It's the same problem over and over and over again, right? Yelling and screaming, and the kid doesn't want to get up, and the parent is already running late for work, and things get chaotic in that relationship. And then there's a lot of resentment and questioning about, am I doing the right thing for the parent? The kid feeling responsible for the parents being upset. So the dynamics start to develop in a very intense way.
So, what does ADHD look like as someone ages into old age, the geriatric level? Does it
Pretty much
change?
the same. I mean, this is
Really?
gonna sound interesting. I have patients in their 60s, 70s, and some patients in their 80s still taking stimulants,
Wow.
right? Because never goes away. And they will tell you after they learn to be attentive and being able to concentrate, they don't want to go back. They don't want to go back to a life where the brain is not working properly, because this is purely a brain disorder. I mean, we unfortunately call attention deficit disorder a behavioral or a learning disorder, because of some of the manifestation. It is a neurological disorder, okay, that gets primarily manifested in childhood as a learning disorder. But it's not a psychiatric disorder per se in the traditional way.
You said before that it's really people were hunters and really it's a survival thing, evolutionarily. But now that we're past that, need a little bit more focus. So how would somebody with ADD, if you were to, they were, diagnose a child, give them a certain amount of dosage that's needed to get through, where would you direct them um, as they move through adulthood when it comes to profession and relationships?
It's really fascinating because when it comes to attention deficit disorder with kids, once they become adolescents, they become very rejecting of everything, including treatment,
Mm.
which is a really bad thing to do, right? So we have a lot of kids just drop from treatment, and the parents, either because of complacency or because of their own attention deficit disorder, never picked on that, right? So you start getting the kid getting in some trouble, making impulsive decision, impulsive sexual activity, impulsive drug abuse. Uh, their grades are going down, and then they become a problem child, right? Uh, so those kids, we very seldom, right, rescue until much later in adulthood when they have some complications, and usually for the wrong reasons. Now, the kids that stay in treatment, I always have this conversation with them, and I've been doing this for 34 years, so now I'm probably seeing the grandchildren of my original patients, which is kind of sad to say. Anyhow, during all that time, I always tell the patient, listen, uh, we can try you without medication if that's what you choose to do and follow you and see how you do. But if the attention deficit is to the point that it's causing you problems at work or is causing you problems in your relationships, you need to consider going back. And this
Mhm.
is important because ADHD is something that the patient needs to take ownership of. You have to understand because they start very early in life. When they start getting treated, they're never asked if they want to. It's not an option, right? So as people grow up, we need to give them the option by explaining the consequences and the benefits of the treatment. Even when they're teenagers, even though technically they don't have a legal option, they have a value option that they have to decide what they're going to be doing with their future, right?
Mhm.
Now, adolescence is probably the most difficult time. Once we get them as adults, they usually it's not as difficult because they're already becoming aware of the consequences, right? They're seeing that their relationship is failing. They're noticing that they're not performing at work, that they're being left behind. So they want to be leveled. They want to be in a level playing field, and they're not. Doesn't matter how smart you are. You can have the most smarts in the world, but if you're not able to pay attention and not respond impulsively, right, then you're not going to be able to make it at the same level of somebody else that has the same intelligence you have without attention deficit disorder.
It's like being able to run fast, but you know you're going to trip over those shoes at some point.
That's
Um,
right.
Truly fascinating subject, ADHD. Thank you for continuing to give us some more information on that. I know you talked about comorbidity. Maybe we'll talk about that in another show coming up. For those of you listening, again, like, subscribe, and share. And if you want some more information about those tests and where to maybe get them, leave a message in the comments section and we'll get you access to that as soon as we can. Once again, Doctor, thank you very much. We'll talk
Thank
to
you.
you
You
next
have a
week.
great night. Bye bye.